Thank you very much. I'm very honored to be here today and delighted to give a little insight into ONCOZON, the cancer network in the southeast of the Netherlands, and to share our experience with the OECI network accreditation. My name is Fabrizia Ketelaars, and I live in the beautiful city of Maastricht, well known for the Maastricht Treaty, which was signed already 32 years ago, and is a great example of where collaboration can lead to. I've worked for the Maastricht University Medical Center for 10 years with the task of building a cancer network. Today, I will briefly introduce ONCOZON and our structure, then share our experience with the OECI network accreditation and its benefits. You already saw this one. ONCOZON is a collaboration between all the 9 hospitals and 1 independent institute for radiotherapy in the southeast of the Netherlands, and it covers a region of about 2 million people. ONCOZON was the first cancer network in the Netherlands in which all the directors of all the hospitals have signed an agreement for the whole of oncology as equal partners. And we agreed that all the institutes participate in all the network tumor groups, and we have these for all tumor types. And in the tumor working groups, we standardize the cancer care pathways, and this is binding. It's important to indicate that there is a distinction between the network tumor working groups, who meet 4 times a year, and network MDTs, multidisciplinary teams, where patient cases are discussed weekly. Of course, we need an organization structure, and we try to keep it as flat as possible. The board of directors consists of the directors of all the 10 institutes. The network board is staffed by the chairs of the oncology committee of each hospital. 6 people from them form a coordination team, which is responsible for the daily control of the network. And below the network board, there are different groups. The most important are the network tumor working groups, which I mentioned just now. Parallel to these, we have several other groups, like patient advisory board, research teams, PA nurses, policymakers, etc. As I said before, every hospital participates in every network working group. We have 12 cancer-specific groups, like breast cancer, lung cancer, etc., and 3 general network groups for rehabilitation, psychosocial support, and palliative care. And our network agreement covers all cancer pathways, except the rare ones which are centralized in 1 or 2 centers in the Netherlands. This means that in our network, all cancer patients, no matter what type of cancer, can rely on the best care in our network. All tumor pathways are determined in the network working groups, and all the institutes commit to the agreements made there. Because of this, ONCOZON is able to function as a single organization at different locations. We believe that you need insight into data to improve care for cancer patients. In order to get independent data, we asked the Dutch Cancer Registry, IKNL, to collect these data for all the institutes in our network. And the epidemiologists who are participating in the network tumor group discussed the data. We signed contracts to ensure transparency and confidentiality. And in this group, we share good examples as well in order to come to one best practice for the whole network. Scientific research is a standard agenda item in the tumor groups to keep this as a priority, to promote research collaborations, and to expand the inclusion of patients in clinical trials. It sounds easy. The best care as close to home as possible, no matter which hospital you enter. But when treating patients as close to home as possible, we have to make sure that the treatment in every hospital is the same. And this we do in the network tumor groups. And if referral is needed, if patients need to go to another hospital, we agreed in which hospital of ONCOZON the care is provided. ONCOZON had been operating effectively like this for years. And then, all of a sudden, the question came up whether ONCOZON would be interested in network accreditation. To be honest, the request to join the network accreditation made us hesitate for a while. We had several questions, such as, would it really add value? Would it be worth the money and the time investment? Aren't we already doing well in ONCOZON? Do we need a new accreditation? Don't we want to reduce the registration load? So after much discussion, the outcome was positive. Our major considerations were, one, the positive experience of the Maastricht University Medical Center, which achieved the comprehensive cancer accreditation in 2021, and it demonstrated that this accreditation led to significant improvements in the quality of care and the connection with research and education, simply by going through the accreditation process. Two, it gets an independent assessment of where you really stand. And three, we realized that not all the standards set by OECI were well developed in ONCOZON, and it gave us the opportunity to achieve these goals more quickly. For being honored to be asked for accreditation, it also facilitated a shared goal in the network. And these considerations outweighed the concerns about money, time investment, and manpower. And then we said yes to the network accreditation. We've set aside 2 years for this challenge and appointed a separate project leader to make the preparations, gather all the information, involve colleagues in the network, fill out the e-tool properly, and get us ready for the actual site visit in November 23. And we were lucky that the project leader was also a good writer. She wrote a monthly blog about this journey for the whole network. As previously mentioned, various topics like cancer care pathways, research, outcomes recur in our network tumor working groups. But ensuring that the PDCA cycle occurs both at network level and individual hospital level requires additional focus and depth. And the accreditation process helped our network to ensure that network agreements were also implemented and evaluated locally. To begin, it's important to mention that ONCOZON already had a strong foundation and many requirements were well integrated into our network. However, this accreditation really sped up our efforts to explore topics like value-based healthcare, research, patient involvement, and collaborations with primary care. And thanks to this accreditation, we formed a core team quality and brought in a quality manager to lead value-based healthcare initiatives into the tumor working groups. We've also activated a research committee focusing on research structures and patient inclusion. And OECI encouraged us to reach out to GPs and the primary care, which, to be honest, is quite a challenge. A big achievement is the formal patient involvement, with all the institutions now represented in the Network Patient Advisory Board. We are very proud of this. What else has it brought? We have bonded as a network. It brought us really closer together. And it brought more structure to our network, leading to better control and understanding across different levels and groups. And the improvement plans we're currently working on, because not everything was perfect in ONCOZON, provide clear direction, helping our network grow into a sturdy, strong, and well-rooted tree. This accreditation confirms that through our intensive collaboration, all patients in the southeast of the Netherlands can count on the highest quality care. And we're already seeing interest from parties like health insurance and the pharma in ONCOZON as a network, partly because the accreditation represents quality. And they know things have well organized in ONCOZON. So that brings me to the take-home message. My take-home message for you is that the OECI network accreditation ensures patient-centered excellence through greater cohesion. Yeah, and I hope our experiences with this accreditation inspires other networks to work on this challenge to improve cancer care. Thank you.